Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Atrial fibrillation, also known as atrial flutter, is a common type of abnormal heartbeat. The heart rhythm is fast and irregular.
Pat Walker is live at St. Vincent Hospital in Little Rock. We're talking heart health this morning. Pat?
Hey, good morning, Greg. Good morning, Deidre. That's right. We're going to talk about atrial fibrillation here this morning. We'll talk about a lot of the other heart topics from St. Vincent Hospital this morning. But joining me is Dr. Raj Chakka. And we're talking about atrial fibrillation. And you work with this a lot, Dr. Chakka. I see this a lot. And it's a matter of the atriums actually beating at an irregular rate?
Yes. Atrial fibrillation is an irregular, chaotic rhythm. The top chamber is quivering. It doesn't have time to pump. It is going so fast, it's quivering. Bottom chamber and top chamber are not in sync. Top is going about 400 or so. Bottom is going, depending on the individual situation and the person, at a different rate.
When they're not in sync, it can create a lot of problems with someone. What's the way feel? What way a person feel when they're not in sync?
It's very variable. Some people don't even know that they have it. The first time they know they have atrial fibrillation is when they come into the ER with a stroke. And then other people who feel really terrible. So everybody in between.
So a lot of different, you may know it, you may not know it, but you said some people may come in with a stroke. This can actually lead to a stroke?
Yes, yes. In the top chamber, the blood tends to swirl around, stay longer than it needs to in certain parts of the top chamber, potentially form a clot. If the blood clot gets released and go upstream, people can have stroke.
Okay, so that's obviously a far-gone case of that when it happens. Now, what are some treatments? What do you do for atrial fibrillation?
For atrial fibrillation, fortunately, there are many things we can do. One is try to make sure they don't go too fast. Give some medicines to slow down the bottom chamber heart rate, because if they keep going fast in the bottom chamber, they don't know it, they can run into congestive heart failure, weakening of the bottom chamber, and things like that. And then other thing we try to do is try to give people some medicine to try and keep them in normal rhythm.
And of course, if it's really foregone, the medicine may not. You actually may have to do some surgery too. Right?
Yes, yes. And
let me ask you one question. If someone thinks they have some of the symptoms of the fatigue, the shortness of breath, they need to see their doctor, then maybe eventually then a heart specialist.
Yes, and the easiest one to you get an EKG. A simple 12-lead EKG can pick it up, or even a monitor strip can pick it up. And sometimes it's hard to pick up. People feel like episodic symptoms that if you go get an EKG, you may not see it. In that situation, we typically put a monitor.
And then you can start really picking it up, get a closer look at it. Thanks very much for joining us, Dr. Chakka, this morning. All right, guys, if you start feeling some of those symptoms, do see your doctor and then get some more advice on this. We'll send it back to you guys in the studio.